When tuberculosis enters the human body, it doesn't develop right away. It's a microbe that grows quite slowly. That's why it can take anywhere from 3 weeks to 6 months from the moment it enters the body to the onset of the disease. This is a fairly long period. Because of this, a person might not even suspect that they are sick. And, moreover, the clinical picture of tuberculosis in its early stages doesn't really differ from that of a typical respiratory illness. That means symptoms like weakness, increased fatigue, and coughing. So what should raise concern? It's a persistent, long-lasting cough that continues for more than 3 weeks. A cough like that definitely warrants concern when it comes to tuberculosis. Also, a body temperature that stays within the low-grade fever range. That means around 37.5 to 37.6 degrees Celsius, lasting for quite a long period of time. Another characteristic symptom is night sweats, meaning heavy sweating mostly during the night. Our patients notice this, they complain about it, but still, for a long time, they might not pay much attention to it. And it often comes to light after the fact, meaning only when they finally go to the clinic. That's how it is. People like this often end up first seeing family doctors with a diagnosis of bronchitis or frequent respiratory infections. If we're talking about children, sometimes they start behaving in ways that aren't quite typical. They start experiencing increased fatigue and a decrease in their usual physical activity. A child who used to be active, participated in sports clubs, or went to dance classes suddenly gives all of that up for no apparent reason. There might also be complaints about headaches or children becoming more distracted. So, the symptoms are pretty nonspecific, which makes it hard to suspect this diagnosis for quite a while. So, we should always keep in mind the potential threat of tuberculosis. Especially since, in our country, epidemic levels have been exceeded since 1995, and every one of our citizens ends up being at risk at some point. And it's important to remember that if there are any red flags, like a persistent cough, fever, or increased fatigue, it makes sense to get checked for tuberculosis, even if you haven't really been bothered by anything lately, except for these kinds of nonspecific symptoms. That's it. As for extrapulmonary tuberculosis, meaning tuberculosis of the bones or joints, it usually presents with more pronounced symptoms than the pulmonary forms. And in general, diagnosing these forms is not particularly difficult. People with these conditions end up seeing specialized doctors, like traumatologists, gynecologists, or ophthalmologists. And during the examination, literally at the very first, initial checkup, this diagnosis can usually be made very quickly. That's it. Unlike pulmonary forms of tuberculosis, which are the most common in our country,